Okay, let's talk about carcinoid syndrome. Episodic flushing is the hallmark of carcinoid syndrome, and it actually occurs to almost 85% of patients. It makes sense that with this severe flushing, the patients can experience hypotension and even tachycardia. If the test gives you a picture of someone's skin, you want to look for, of course, the flushing that I mentioned, telangiectasias, and also cyanosis. The GI manifestations include diarrhea or cramping. Another high yield point is what happens when it comes to the cardiac system. These patients have valvular lesions. The right side is more common than the left side. And in pulmonary manifestations, you want to look for bronchospasms. You can confirm the diagnosis with elevated 24-hour urinary 5-hydroxy HIAA test. You can also get a CT or MRI of the abdomen and pelvis to localize the tumor itself. There's something called an octreoscan that you can get to detect any metastases. And of course, if the patient has any heart disease symptoms, get an echo. The treatment for these patients is octreotide for symptomatic patients, and also prior to surgery or anesthesia, you want to give octreotide. If the patients have any metastases to the liver, you want to have surgical excision. It's easy to mix up some of the cardiac symptoms with something like an infective endocarditis. So look out for intravenous drug use if you're really thinking this, and remember that people with infective endocarditis have very constitutional symptoms like fever, malaise, and arthralgias. If the patient has flushing or that diarrhea, remember to think carcinoid syndrome instead. The same thing goes for weakening of the connective tissue of valvular structures, which is also called myxomatous valve disease. These patients with myxomatous valve disease can present a lot like the carcinoid patients, at least cardiac-wise, but remember the cardiac symptoms are not the only parts of carcinoid syndrome. Look again for flushing or diarrhea.